Hello everyone, welcome to the Voice of Homeopathy. Today we'll discuss how to search clinical rubrics and how to convert modern medical terminology and to synchronize it with our older terminology in texts and repertory and medica and rubrics given out there. How to find the clinical rubric and solve the case. So in front of you, this is a case of umbilical granuloma, a 6-month-old infant having this fleshy growth growing out of his umbilical area. Now, about this condition, what should have happened is after the birth, uh, the umbilical stump should have shredded and umbilicus should have receded it, towards its normal position. But due to the congenital defect, you see thick, proud flesh oozing moist, growing out of the umbilicus, also giving utter anxiety to the parents what to do, to find a pediatric surgeon, how to deal with the case, like daily dressing, lot of fluid oozing out of it, having the baby is irritating about due to this, and having lot of eruptions due to this fluid, also some smell from the fluid, daily changing the dressing. You can just imagine the mental status of the parents. So if you read the USG report, it says collapsed vitelline duct and with umbilical granulum, right? So now here comes the role of knowledge and wisdom of the homeopath. Knowledge and wisdom means when you, like, over the period of time, you get a lot of experience practicing homeopathy constantly and reading your all the mathematica's repertories tirelessly without fatigue, constant. Then after a certain stage, you reach a point that you evolve as a homeopath, and whenever you see a clinical condition or a case, your mind clicks. Okay, I have read it somewhere. Right. Now, the only thing you need to do is to like research some more and find it where you have read it before. Our stalwarts have written everything for us. They have mentioned everything, whatever they could have done in one single life, they did tirelessly till the end of their life. Right. So you all must have gone through this page of Kent repertory in your life many times. But have you seen these three words? Proud, flesh, umbilicus. Calcarea carb, the only single medicine, head remedy in this particular rubric. Don't you think this these three words fit exactly to our case? So now tell me in the comments how many of you have gone through this rubric or have used this rubric in this way. So whenever you see a case or you find some symptom or rubric, always have a 360 view of the case and repertorization. So if you go to the PHATAK repertory also, so it says in the naval section, it says proud flesh, calcarea carb, again the remedy, along with kali carb and natramure also, right? So now Phatak was a homeopath post Kentian era. So he must have adopted this rubric and this medicine added to his repertory after verifying the symptom in his practice from Kent. Okay. But where did he got this Kali carb and natramure from? So when you are having 360 view of the case, always go to the source of the where think that where the author would have taken this rubric from, where he would have adapted this from. So if you search deeply enough, if you have the zeal to heal, and you will do. So just search proud flesh. Okay. And what you see, like plenty of authors, plenty of repertories are giving rubrics related to like proud flesh. Okay. And what is proud flesh? Basically, what you see is uh, like fleshy or muscular overgrowth from any part of the body. It is a sign of a psychotic miasm. And if you go to the source book of this rubric, if you go in the herring guiding, mostly the source book, what I have seen, most of the authors have adopted in their repertories in Mathematicas are from Mathematica Pura, Allen Encyclopedia, and herring guiding symptoms of Mathematica. Mostly, most of the medicines are adopted from any author who is writing a book must have taken some symptoms or rubrics from there. If you go to the calcarea car abdomen section, soreness of navel, a moist excrescences like proud flesh from the navel of infant. Also, medicine mentioned kalika and abdomen. Okay, so in this way, Dr. Phatak has adopted that rubric. But if we go a bit further, now go to KNERR repertory. Okay, so first of all, reading KNERR repertory or studying it is itself a very tedious task, because if you have the older version, the rubrics and words are very small, concise, packed, fitted very closely. Okay, so you must have a good eyesight for that. Okay, so go to the abdomen, navel section. See moist excrescences like proud flesh in infants, calcarea. So always go back to the source book where the author has taken rubrics or symptom from. So that's it for today. Please like, share, and subscribe. And if you think the video is worth enough, and if it is providing some knowledge or enhancing your experience, please do share with your other homeopaths or your colleagues. Also, in the upcoming times, I'll sharing about this case more, and also will be posting more videos regarding this topic, like clinical rubrics, modern medical terminology, convert them into a older terminology, and how to solve these case type of cases, which are not mentioned in our Mathematica as it is, but yes, they are given somehow in some other view with a other viewpoint, right? So that's it for today. Thank you and have a nice day. Goodbye.